Hello everyone, welcome to QXON. This is Dr. Parinita, your biochemistry teacher here at QXON. Today I'll be discussing the cases related to carbohydrate metabolism. When I say carbohydrate metabolism, what you understand is all about the glucose metabolism, galactose, the glycogen, etc. So here, how the carbohydrates are utilized for the energy purpose, how they are metabolized, how they are stored, and what are the related disorders is all about the carbohydrate metabolism and the diseases. So the main important diseases what you have got to learn here for your level is about diabetes mellitus, diabetic ketoacidosis, galactosemia, and the von Gerk's disease. So, what you are supposed to know here: what exactly is diabetes mellitus, how it is caused, what is diabetic ketoacidosis, what are the other disorders like galactosemia and the von Gerk's disease. So, let's start with the cases. The first case: a 48-year-old obese female came to the hospital with complaints of generalized weakness, increased frequency of passing urine, thirst, and increased appetite for the past 3 months. Following were the findings from her lab investigations: fasting blood glucose 150 mg per deciliter, postprandial blood glucose 260 mg per deciliter, urine Benedict's test orange precipitate, urine ketone bodies absent, and HbA1c level was 8%. Now looking at the clinical presentation and the investigations, what you can see here is she has generalized weakness, increased passing of urine, increased thirst and increased appetite, and her fasting blood glucose level is increased, that is the normal is 70 to 110 mg per deciliter, whereas here it is 150 mg per deciliter. Postprandial blood glucose levels also are increased in the patient. Urine Benedict's test is orange, shows orange precipitate, which indicates that urine Benedict's test is positive for the reducing sugar. It doesn't exactly say that it is glucose what is present in the urine, but it says that it is a reducing sugar what is present. Orange precipitate indicates the amount of percent of the sugar present in the urine. So different colors indicate the different percentage of sugar present in the urine. Urine ketone bodies absent indicates that there is no complication over here. HbA1c level, that is glycated hemoglobin levels, are increased. Now, what is the significance of this HbA1c is that it indicates or it represents the control of the blood glucose level for the previous 3 months. So here it is increased, where it has to be, the normal has to be up to 6%. So altogether, with the clinical presentation and the lab investigations, we can come to a probable diagnosis of a case of diabetes mellitus. Now, when I say diabetes mellitus, what exactly it is? It is a syndrome or a group of metabolic disorders characterized by inappropriately high blood sugar, that is hyperglycemia, over a prolonged period. Diabetes mellitus, it's a chronic disease which prevents body from properly utilizing the carbohydrate for the energy purpose. So symptoms of hyperglycemia include frequent urination, increased thirst and the increased hunger. So when I say now again diabetes mellitus, there are different types of diabetes mellitus. We have the type 1 and the type 2 diabetes mellitus. Type 1, which was initially called the insulin dependent diabetes mellitus, which is an autoimmune condition with circulating antibodies against the beta cells of pancreas, which lead to selective damage and destruction of the beta cells of pancreas with no secretion of insulin. Hence, in case of type 1 diabetes, it is deficiency of the insulin. This is a juvenile onset diabetes where it is seen in the childhood. We have the type 2 diabetes mellitus, which was formerly known as non-insulin dependent diabetes mellitus, or the NIDDM. Usually the onset is in obese person after the age of 40 years. Here what happens? It is there is presence of insulin resistance. Okay, so the action of the insulin is not effective, hence develops diabetes mellitus. There are other types of the diabetes mellitus which are prone to develop the uh, active diabetes cases, that is gestational diabetes, diabetes mellitus, or increased blood glucose level which develops during the pregnancy state. And there's something called impaired glucose tolerance, where the blood glucose level is between 110 to 126 milligram per deciliter, which is also called as a pre-diabetic state, who are again at risk for developing the active diabetes mellitus. And also people with a family history, obesity, sedentary lifestyle, physical inactivity, hypertension and hyperlipidemia are also prone to develop this condition. Coming to the diagnostic criteria. So here, when the patient's fasting blood glucose level is more than 126 milligram per deciliter and postprandial blood glucose level is more than 200 milligram per deciliter, we can conclude that the patient is suffering from diabetes mellitus. When the age is above 40 years of the person, then you conclude it to be the type 2 diabetes mellitus, which is due to the insulin resistance. Now coming to the relevant investigations. So before going into the investigations, let's see what are the metabolic changes which occur in diabetes mellitus. So it has, being a metabolic disorder, it has effect on, or it affects the carbohydrate, fat and the protein metabolism. So hyperglycemia and ketosis are the characteristic features. Ketosis develops as an acute complication here. Hyperglycemia, how does it develop? That is due to non-utilization of the glucose what is present because of insulin resistance. Because though there is increased blood glucose level, the glucose cannot be utilized due to insulin resistance. So the body senses it as hypoglycemia, as the glucose what is high cannot be utilized by the body, leads to glycogenolysis, again adding up to the glucose level, and also diminishes the peripheral utilization of glucose, that is glycolysis. Now as the glucose cannot be utilized here, body depends upon the fats for energy. So fats undergo beta oxidation, resulting in the formation of acetyl-CoA. So what happens to this acetyl-CoA? Acetyl-CoA concentration increases, which exceeds the capacity of liver to utilize this acetyl-CoA in the TCA cycle for energy release. So acetyl-CoA, whichever is excess, is channeled towards the synthesis of cholesterol, hence results in hypercholesterolemia, which can lead to atherosclerosis, a potent cause for micro and the macrovascular complications in a diabetes mellitus case. So before getting into again the investigations, let's see the biochemical changes or the metabolic changes what I mentioned earlier. Because of the mentioned metabolic changes, we observe hyperglycemia ending up with the glycosuria, that is increased excretion of glucose in urine. So because there is increased excretion of glucose, it carries more amount of water, leading to polyuria. So because the glucose cannot be utilized by the body and senses hypoglycemia, there is polyphagia, increased intake of food. Because of all this, that is decreased utilization of glucose, the patient ends up with weight loss and polydipsia because of increased loss of water through polyuria. So these are the presenting symptoms or the signs of a case of diabetes mellitus. Now going back to the investigations, what are the investigations which are to be done in a case of diabetes mellitus? What we know is the fasting blood glucose level and the postprandial blood glucose level to diagnose a case of diabetes mellitus. What other tests can be done, relevant investigations which can be done in a case of diabetes mellitus to further improve the health of the patient. One is lipid profile, where we know that there is dyslipidemia and hypercholesterolemia in a case of diabetes mellitus. Then we have renal profile. Renal profile is done to check for the diabetic complications, that is serum creat, urea and the uric acid levels. Check for the microalbumin in the urine. So presence of microalbumin indicates the early stage of renal damage in a case of diabetes mellitus. Then you have the fundus examination, which helps in preventing the complications developing due to diabetes mellitus. So these are the relevant investigations which can be done in a case of diabetes mellitus.